The majority of residents of aged care facilities have problems with their cognitive function. Many have dementia. So they also have many other illnesses, which really means that they find themselves on quite a lot of medication. There's a need to review medications periodically to ensure that the medications are not causing problems and that they're indeed producing benefits. And often this needs a team, and particularly it's useful to have a pharmacist with experience in making these reviews to be involved with the general practitioner in reviewing the medications. Sometimes geriatricians get involved when it's really complicated, and so then there becomes an issue of communicating amongst the GP, the pharmacist and the geriatrician. Health professionals are working together in a hospital setting. Of course, they go into a room and have a team meeting. When you start talking about aged care facilities, these three individuals, in this case, say a geriatrician, a general practitioner and a pharmacist, and for that matter the nursing staff in the facility, will very rarely be in the same place at the same time. To get together, they have to travel. As soon as you introduce travel into the equation, the cost goes through the roof. And even in the most simple example where a pharmacist is reviewing medications at a facility, he or she still needs to travel to the facility. So this puts a huge overhead on the cost of doing the procedure. So we figured that by using telehealth we could solve two problems. One is to reduce the time spent by pharmacists in travelling to the facility if they could indeed do the medication review remotely. And secondly, to enable a conversation to happen between the pharmacist, the GP and the geriatrician in a virtual way when they could look at each other's opinion and then come to a view about what the proper prescription would also save trouble but also enhance the communication, effectively creating a virtual team and getting the benefits of having a group of specialists working together. So that was what inspired this telehealth project. They found it mutually beneficial to be able to interact with each other in this virtual environment.